Okay, so anyone, those that snore already, know that you're in that direction. So beware that the snorers, I always want to make sure you're not tongue-tied. So we can do a little more analysis when you're sitting here in front of me, but tongue-tied makes your tongue stay low in the mouth and not support the back of the throat, right? It's going to be down here, and what happens to the back of the throat? It falls. So we need to, make sure you're not tongue-tied. If you are tongue-tied, you do about a month's worth of these exercises. Then if you want my help, I can kind of guide you through. I don't do any releases myself, but I know a few doctors that do. And it's made a huge difference on neck tension and clenching for people. So if you have chronic, like you don't know how to relax this, it could be that. I'm not saying. So everybody put the tongue in the roof of their mouth and open and close like this. Tongue tip up, open, close. Like if you want to relax your jaw, every hour on the hour do 6. Wherever you're at, sit up tall, get your sternum up, and that centers the joint, the condyle of the TMJ, right in its socket. And like a floating jaw, okay? The one that I gave you before was you can do tip or you can do entire tongue. The entire tongue you can bounce like that, or you can hold 5 seconds and pop it. That's called the cave. Okay? All right. So the last one we're going to do now is called reduced breathing. Reduced breathing is an exercise to slow down your breath and slow down the volume. So put your finger under your nose. And I like this one because it kind of is inconspicuous when you want to do it in front of people. You breathe in, you're just thinking. You breathe in, pause at the top, exhale strongly once. Do you feel that volume? Okay, now make it so light that you almost can't feel it. So breathe in, pause at the top, exhale lightly. Pause at the bottom. Breathe in again. Not a huge breath. We're going to make our breath small. Pause, exhale light. So this is called reduced breathing exercise. It's not a comfortable one. And if you feel uncomfortable, you're doing it right. But if you're feeling like it's making you too anxious, don't reduce it that much. Give yourself a little bit of leeway. And if you're nervous, stop for a moment, resume in a few seconds. But this is a 5-minute exercise. Okay? So you set the timer and you're on the airplane or watching a show or watching a movie and you're just reducing. Remember, Buteyko believed we all needed an air diet. This is an air diet. We're trying to give you an air diet. Everything's through the nose. The nose filters, it humidifies, it releases a very important gas called nitric oxide that sterilizes your air. Nobody tells you that. Nothing gets sterile through the mouth. You just ingest bacteria and viruses. The nose is how you're supposed to filter it. It makes it warm. It makes it the right volume. So we're just going to try to make it. Oh, I always pause at the bottom and pause at the top and lighten it. And this one is in between when you're traveling and you're not having to talk to anybody, or you're watching a show or a movie. For part of it, do this. Or do breath holds. You don't have to talk. You could take advantage of that time.